today's Eye on Health, we know the holidays can be joyful, but they can also be stressful.
In fact, Highmark Health recently conducted a questionnaire to gauge behavioral wellness, and they did this in a very visual way. Joining us with more on How's It Going survey are clinical psychologists Doug Henry and Aimee Girod with Highmark Health. Thank you so much for being here.
It's our pleasure.
So tell us about the How's It Going survey. This has popped up everywhere. Boaz says that he's seen the signs for it too.
I've been seeing it around town, and I was like, I wonder what this is for. And so it's nice to meet the people who are organizing it.
So there have been 10,000 people who've actually taken part in this survey.
That's right. So we had a great response to the survey, and the whole point of the survey was to normalize the conversation about mental health and to reduce the stigma that sometimes prevents people from coming forward to receive help. And the response has been overwhelming. Since the first day that we kicked off in Market Square, the response has been, by volume, much more than we had anticipated.
Wow. So what are some of the things you've learned from the survey?
We've learned that Pittsburghers are quite stressed.
Yeah.
So 3/4 of Pittsburghers report being severely or to moderately stressed. And about 1/3 of those report that stress is really dominating their experience, and so of clinical proportions. So we've learned that the need for mental health services and supports is ubiquitous. It's all over the place.
Yeah.
But the good thing is they say that they have good, strong relationships.
That's right.
They have people that they can count on. So I think that was something that's really good that came out of the survey.
And so this is looking at sleep, diet, relationships. I mean, the stress can impact at any number of coping strategies, current feelings even. Tell us about some of the questions. Is it just, how's it going, or is there more to it?
No, I think that Aimee just hit on a key finding about relationships. So we asked several questions about relationships. Relationships are so important to managing stress. Life is really difficult lived alone, but with family and a social network, stress is much, much more manageable.
And so once you have this information, like, what do you do with that information?
Aimee, do you want to?
I think it's just awareness, right?
Yeah.
Letting
Yeah.
people know, and things like this to say that you're not alone.
Right.
And it's okay to talk about it. And I think also awareness to help people know what to say, what to do. There are resources out on the website to help, what questions to ask. How do you support people in your life? How do you find out how they're doing?
Yeah.
So I think those are the biggest things that come out of this.
Well, I know it wasn't holiday specific, but certainly around the holidays, it feels like everyone's a little stressed, and then you get all these stressed people
Everything
together in a
else.
room together, which is maybe not the best. I feel like I've had that holiday experience before.
Yeah, so get outside.
Yeah.
Yeah. This was really good, though. There was an encouraging finding. You were talking about being alone and how we know that's not good for anybody, but 64% of those surveyed reported their relationships, whether romantic, partnerships, friendships, are going in a positive direction, which is good. At least we have support systems in place, right?
And yes, and that is the saving grace. And we really encourage people over the holidays to tend to their relationships, to focus on them, to put the cell phone down, to reach out to that family member or friend that you haven't spoken to that you wish that you were closer to. And go for visits, And also I want to highlight something that Aimee said, get outside. Go for
Yes.
walks with the people that are important in your lives. Get outside, get sleep, make sure that your food and your drink intake is moderation in everything. But you do have to, at times of heightened stress, you want to go back to the basics. Am I sleeping? Am I eating in a moderate and appropriate fashion? Am I getting enough exercise and fresh air?
We know that, I mean, there are different seasons of life, right? I mean, I'm just looking back to when I was a new parent and like sleep doesn't come.
Yeah.
It doesn't come, and then you're going back to work, and maybe it's the holidays, and you have all of this stuff starts to pile on, and there's really no way to get out. You just have to get through it.
That's right.
And so, but it's good to have those support systems. So I want to ask you about resources, because that can sometimes be the way through it, right?
For sleep in particular, we have a program that is providing cognitive behavioral therapy for insomnia that has been really robust just over the past year in gaining a lot of momentum in terms of utilization, the number of people that are being treated for insomnia. And that helps in a wide range of aspects. Helps your mood, helps your anxiety level, your stress levels.
Sure.
So that is one thing. But our resources, people can find resources on highmark.com. And there are a host, you don't have to be a Highmark member, there are a host of directions for where to get mental health services, how to get support, and even some healthy conversational tips for how for engaging family around the holidays.
Gosh,
really
that's
good
very helpful this time of year.
Thank you. Thank you for coming on. And the survey is continuing, is that right?
It is
Yes.
continuing.
Okay, very interesting. Thank you so much. Highmark continues to expand access to behavioral health resources for its members. Mental well-being powered by Spring Health will become available to more than 2 million Highmark members in January. And please remember, if you are in crisis or experiencing suicidal thoughts, call or text the National Suicide and Crisis Lifeline. 988 is the number to use.
And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesday, and it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.